By a show of hands, how many of you are treating fibromyalgia? Okay, about a third of you. So how many of you are treating fibromyalgia just to treat the pain? Or just with muscle work, massage, chiropractic, designed to be affected at the nerve and the muscle itself? Okay, most of you. So how many of you are treating it neurologically? How many of you are treating the brain? Very few of you. Well, fibromyalgia is not a muscle problem, as we're finding out from the literature. Fibromyalgia is a nerve problem. It's a brain problem. That when they go and they look at the muscles under microscope, when they do tests on them, they find there's nothing wrong at the end organ or where the nerve connects to the muscle. So why is the symptom there? Fibromyalgia is basically a brain and nerve problem. The drugs that they give for it, like Lyrica and other off-label drugs, which are for epilepsy, are neurological drugs. They're designed to stimulate or inhibit the nervous system, the brain. And they have varying degrees of effectiveness. And I've had patients with fibromyalgia that are taking the medications. Some like them, some don't. Some have good results for a while, and some that it just wears off. So, if it's a brain problem, why don't we treat the brain? And if it's a metabolic problem, if it's an endocrine problem, why don't we treat the endocrine system? Why don't we support the system? Why don't we support the brain, neurologically and nutritionally? We do, of course. And that's what we're going to talk about. Okay? In my program, we treat fibromyalgia patients neurologically and metabolically. Okay? Every test that we do, every lab work that we send patients out for is designed to look at the person as a whole. It's designed to find out if they have something malfiring, misfiring in the brain, and or if they are nutritionally supported or not. Because it doesn't make sense to treat the dog's mouth if you stepped on its tail and it's barking out its mouth because you stepped on its tail, but it doesn't bark out of his tail. So the symptoms, which seem to be mostly the posterior and extensor muscles, pain, trigger points throughout the body, of those 18 trigger points, mostly posterior. Okay, we're looking at a brain weakness, and we're looking at nutritional insufficiencies or deficiencies where they're not supporting the process, where they do not have enough fuel for the brain or the nerves themselves. So what do we do for that? Well, after we do the testing, after we do basically a complete blood panel, sensitivity testing, then we go and we do the neurological tests. Makes sense, doesn't it? Look at the person as a whole. Look at the two controlling systems, the nervous system and the endocrine system. Okay? And there's simple things you can do from questionnaires. Simple, do you have this? How often do you have this? On a scale of 1 to 10 or 0 to 3. How much does it affect your quality of life? When do you notice the symptoms? All the way up to the expensive hundreds and a couple $1,000s of blood work, lab work, stool testing, salivary, adrenal function, where you can actually test to see how much cortisol is being released through the saliva. Gets shipped off, comes back. You don't even have to touch it. And then you can get the results from that. So sometimes if it's a low-tech way, if the patients don't necessarily have the full amount to pay for all the testing, then you can do it the simplified way. But with simplified comes, lesser results when it comes to the overall picture. But there's different ways that you can treat this. So if you want to fire up the brain, if you want to clear out the endocrine system, you have to fire up the pathways that inhibit the brain the best. So you could have them do imagery or, counting coins and feeling around, and that fires up the parietal lobe. Or you can fire up the spinal cord, certain pathways that are going up. Tickling their feet or pinching them on the hand, the only way they feel that is because it gets to the brain, of course. Contralateral side, opposite. Right side of the brain controls and senses the left side of the body. Left brain controls and senses the right side of the body. So if we work with the main neuraxis around the muscles of the spine if we use spinal decompression, which I use heavily for decompression patients. Very few go through a program and don't have spinal decompression done because it is so effective at treating fibromyalgia. As well as, vibration sometimes, warm calorics in one ear or the other. Sometimes auriculotherapy, which is like electric muscle stim for certain pinpoints on the ear. And then we get them stabilized nutritionally. And if they follow through, if they do what they need to do, that you tell them to do, like I tell them that if they're not going to follow along, if they're not going to follow my recommendations, then why would I accept them as a patient? Why would you accept them as a patient? If they're not going to do what they're supposed to, it's not like you're assigning them to spend an hour every single day running up and down a mountain. Now, if you have a weight loss program like I do, if you build them up to that and that's their goal, you could do that. If you want to be the next Bob or the next Jillian, the biggest loser, and get them running up and down mountains for hours a day, if that's their goal, you could do that. But their first goal is to help them get rid of the pain. And you have to do that by treating them neurologically and metabolically. So, unless they're going to do what you tell them to do, which is very simple, part of it's just showing up. What coach said that, part of success, 90% of success in life is showing up? Or Yogi Berra, who said that 90% of baseball is mental, the other half is physical. But when you treat them neurologically, when you use decompression, vibration, cold laser, when you treat them nutritionally, when you stabilize the system, when you get the right pathways fired up, get them metabolically restored so they have the right enzymes and coenzymes, the right nutrition, it's really pretty simple. They're easy enough to treat if they follow what you say. So you just need to find the right person who is going to follow what you tell them to do. And don't accept the rest. Don't waste time with patients who aren't going to do what they need to do to get better. There's entire support groups where they sit around and just, they want the label almost. They become friends with everyone else that has the label. And it's very unfortunate because it's like the crabs in the bucket. Okay, you ever seen crabs in a bucket, live crabs, or seen the poster or seen the video, where one crab tries to climb out to avoid capture and survive, and the other crabs just pull them back down. And so no crab will make it out of the bucket because all the other crabs are pulling them down with them. And that happens sometimes. It's very unfortunate, but when you live with chronic pain and nothing else you've done has worked because it's the wrong approach, it's the wrong model, then you're going to be stuck like, the patient will be stuck like the crabs in the bucket.